How to understand your biopsy pathology report. Have you ever received a medical report and felt overwhelmed by the information? If you or a loved one has gone through a biopsy, understanding the pathology report can feel daunting. Let's break it down together in a way that makes sense. A biopsy pathology report is a detailed document created by a pathologist. This medical professional examines tissue samples taken during a biopsy to determine if cancer or other diseases are present. For families and caregivers, knowing how to read this report is essential for supporting a loved one facing a cancer diagnosis. First, the report will identify the type of tissue examined and where it was taken from. For example, it might say skin biopsy, left arm, or breast biopsy. This information confirms the origin of the sample and sets the stage for what follows. Next, one of the most important parts of the report is the diagnosis. This section tells you whether cancer is present. If cancer is found, it will specify the exact type of cancer cells. Another key element is the tumor grade. This describes how much the cancer cells resemble normal cells under a microscope and how quickly they may grow. Grades are often numbered from 1 to 3. Grade 1 cells look more normal and grow slower, while Grade 3 cells appear abnormal and tend to grow faster. The report will also discuss tumor margins. This indicates whether cancer cells are found at the edges of the tissue sample. If the margins are negative or clear, that means no cancer cells are at the edge, which is a good sign. If they are positive or involved, it means cancer cells are at the edge, possibly requiring more surgery. If the margins are close, it suggests cancer cells are near the edge, which might also need further treatment. For some cancers, the depth of invasion is noted. This describes how deeply the tumor has penetrated into surrounding tissues, which can impact treatment options. The report may also mention vascular or lymphatic invasion. This indicates if cancer cells are found in blood vessels or lymph vessels, which can suggest a higher chance of spreading. If lymph nodes were biopsied or removed, the report will state if cancer has spread to these nodes. Lymph nodes are part of the immune system and can act as pathways for cancer to spread. Sometimes, additional tests are performed on the biopsy tissue to look for specific genetic changes or proteins. These results can help doctors choose targeted therapies tailored to the cancer type. While the cancer stage is often determined by combining biopsy results with imaging and other tests, the pathology report contributes important information about tumor size, spread, and lymph node involvement. Staging is crucial for guiding treatment decisions. For families and caregivers, it is helpful to ask the medical team to explain any unfamiliar terms in the report. Remember, this report is just one part of the diagnosis and treatment planning. A pathologist's findings guide doctors in choosing the best treatment options. If margins are positive or lymph nodes are involved, additional surgery or therapies might be necessary. Supporting your loved one by helping them prepare questions for their doctors about the report can make a big difference in their care journey. Understanding a biopsy pathology report provides detailed information about the presence, type, and behavior of cancer in the tissue sampled. By grasping the main components, diagnosis, grade, margins, invasion, lymph nodes, and molecular tests, you can better comprehend the situation and participate in care decisions.